You noticed it a few weeks ago, maybe longer if you are being honest with yourself. You sit down at the end of the day, in your chair, on the couch, wherever you land when everything is finally done, and you look down and your ankles are not the same as they were this morning. There is a puffiness there, a thickness that was not there at breakfast. You press a finger into the skin just above the ankle bone and the impression stays for a moment before slowly filling back in. You pull off your sock and the elastic line is printed into your skin like a ring. You think, that was not there when I got dressed. Maybe you mentioned it to someone. Maybe you did not, because it went away by morning, because it did not hurt, because you told yourself it was probably from sitting too long or from the heat or from something you ate. And then it came back the next evening, and the one after that. That pattern, ankles that swell as the day goes on and reduce overnight, is one that I see in my practice more than almost any other physical complaint in adults over 60. And I need to tell you something clearly. The fact that it goes away by morning is not reassurance. It does not mean the problem is minor. In some cases, it means the exact opposite. My name is Dr. James Harlow. I have practiced internal medicine and cardiology for over 25 years. And evening ankle swelling is one of those symptoms that sits in a very wide range, from completely benign to genuinely urgent. And the difference between those two ends of the range is something I want to help you understand today. Because the way most people handle this symptom is to wait and see. And depending on what is causing it, waiting and seeing is exactly the wrong response. Let me start by explaining what is actually happening when your ankles swell. Because once you understand the basic mechanism, you will immediately understand why it matters. Your body circulates blood in a continuous loop. Your heart pumps blood out through the arteries. It travels through progressively smaller vessels to reach every tissue, and then it returns through the veins back to the heart to be pumped out again. The veins carrying blood back from your legs have a harder job than almost any other veins in the body. They are working against gravity, pushing blood upward from your feet to your chest, through vessels that have no pumping mechanism of their own. They rely on the squeezing action of your leg muscles when you walk, and on a series of one-way valves inside the veins that prevent blood from falling back down between steps. When you sit or stand still for extended periods, that muscle pump mechanism stops. Blood moves more slowly through the leg veins. Pressure builds in the lower vessels, and when pressure builds inside a blood vessel, fluid gets pushed out through the vessel walls into the surrounding tissue, the tissue of your ankles, your feet, your lower legs. That fluid accumulation is what you see as swelling. This basic mechanism, fluid accumulating because of venous pressure, is the foundation of almost all ankle swelling. But the reason that venous pressure is elevated in the first place is where the stories diverge dramatically. And this is where I need you to pay close attention. The most common reason, and the one that is least medically urgent, is simply that the one-way valves in your leg veins have weakened with age. This is called chronic venous insufficiency. The valves no longer seal perfectly, blood pools in the lower legs during the day, fluid leaks into the tissue, and your ankles swell by evening. It is uncomfortable. It can worsen over time. It deserves treatment, but it is not an emergency. The reason that requires urgent attention, the one I do not want you to miss, is the heart. Your heart is a pump. When that pump begins to weaken, when it cannot push blood forward with the same force it once could, blood backs up in the system behind it. And the lowest point of that backed up system, the place where the pressure accumulates most visibly because gravity is working against it, is your ankles. Evening ankle swelling can be the first visible sign of heart failure. Not heart failure in the dramatic, collapse on the floor sense that most people imagine. Heart failure in the medical sense means the heart is pumping less efficiently than it should, a condition that develops gradually, that is frequently present for months before it is diagnosed, and that in its early stages produces exactly the kind of swelling you might be experiencing right now. I want to be honest with you about something. Heart failure affects over 6 million Americans. It is the leading cause of hospitalization in adults over 65, and a significant proportion of the people who are eventually diagnosed with it spent months before that diagnosis attributing their ankle swelling to sitting too long, to the heat, to their age. So how do you know which one you are dealing with? There are specific patterns that help distinguish venous insufficiency, the less urgent cause, from early heart failure, the more urgent one. And I want to walk you through them carefully because this is the information that actually matters. With venous insufficiency, the swelling is almost always limited to the ankles and lower legs. It does not climb above the knee. It is typically equal on both sides. It improves completely with elevation. If you lie down and prop your feet above heart level for 30 minutes, it resolves. It has been present for years rather than weeks, and it is not accompanied by any other symptoms. With early heart failure, the swelling often begins the same way, in the ankles, worse in the evening, better in the morning. But there are accompanying signals that tell a different story. A shortness of breath that was not there before, particularly when climbing stairs or walking a distance you used to manage easily. A need to use an extra pillow at night because lying flat makes you feel slightly breathless or uncomfortable. A persistent tiredness that is different from normal fatigue. A heaviness, a limitation. A weight gain of 2 or 3 pounds over a few days without any change in eating. That is fluid accumulating inside the body before it becomes visible outside. Any of those additional signals alongside ankle swelling is a same-week medical appointment. Not a note to mention at your next scheduled physical. A call tomorrow morning. There are 2 other causes of ankle swelling that are important enough to mention and common enough in this age group that I would be doing you a disservice to leave them out. The first is medication. A significant number of medications commonly prescribed to adults over 60 cause ankle swelling as a direct side effect. Calcium channel blockers, a class of blood pressure medication that includes amlodipine, nifedipine, and felodipine, are among the most frequent culprits. They cause the small blood vessels in the legs to relax and widen, which reduces the pressure driving blood back up toward the heart and allows fluid to pool in the ankles. This is not a sign of heart disease. It is a predictable pharmacological effect. But because it looks identical to other causes of ankle swelling, patients spend months worried about their heart when the actual cause is sitting in their medicine cabinet. If you started a new blood pressure medication in the months before your ankle swelling began, bring that specific timeline to your doctor's attention. There are alternative medications within the same class and different blood pressure drug families entirely that do not produce this side effect. This is a solvable problem. The second is kidney function. The kidneys regulate the balance of fluid in the body by controlling how much salt and water are retained versus excreted. When kidney function declines, which happens gradually in a significant proportion of adults over 60, often without obvious symptoms, the kidneys retain more sodium and water than they should. That excess fluid has to go somewhere. It goes, by gravity, to the lowest point of the body, your ankles. Kidney function decline is measured by a blood test, creatinine and estimated GFR, the glomerular filtration rate, that should be part of routine blood work for adults over 60. If it has not been checked recently, or if your most recent result showed any reduction from previous values, that is worth a specific conversation with your physician in the context of your ankle swelling. I want to address one more thing before I close because I think it is the most practically useful thing I can tell you. There is a simple test you can do right now that will give you meaningful information about your own ankle swelling. Press your thumb firmly into the skin on the top of your foot or just above your inner ankle bone. Hold it there for 5 full seconds. Then release and look at what happens. If the impression left by your thumb fills back in immediately, the skin bounces back within a second or two, the swelling is likely mild, and the fluid is moving freely through the tissue. If the impression stays, if there is a visible pit in the skin that takes more than a few seconds to fill in, this is called pitting edema. The fluid in the tissue is under enough pressure that the tissue cannot immediately spring back. Pitting edema that is new, that has been present for more than 2 weeks, or that is worsening over time, is a finding that belongs in a medical conversation. Not because it always indicates something serious, but because it indicates enough fluid accumulation that the underlying cause needs to be established. You deserve to know why your body is doing this, not to manage the swelling cosmetically, to understand what your circulation is telling you, and to address it at the level where it originates, rather than watching it in the mirror every evening and hoping it stays the same. If this video helped you understand something about your own body that you had been uncertain about, Share it today with someone you know who has been noticing the same thing and has not said anything. They are out there. This is exactly the kind of symptom that people carry quietly because it does not seem dramatic enough to mention. Subscribe to this channel. Leave a comment below telling me how long you have been experiencing this and whether any of the causes I described sounded familiar. I read every one. I am Dr. James Harlow. Take care of your heart. I will see you in the next video.